Okay, so we've all been there, right? That little worry, a health thing, and bam, you're typing symptoms into a search bar.
Oh, absolutely. And suddenly you've diagnosed yourself with something pretty terrifying, usually.
Exactly, which is why today, for this deep dive, we're really going to get into that whole world, online self-diagnosis, but seen from the inside of an urgent care clinic.
Yeah, it's a fascinating perspective
Yeah,
because that's where the digital anxiety meets actual medical practice.
right. So our mission here really is to understand how this online info works. It's helpful sometimes, scary other times, a real double-edged sword. We want to know what happens when that fear, the fear from Google, walks into the exam room.
And how we can all maybe get a bit better at handling all this information that's out there.
And to do that, we're digging into some amazing source material. It's excerpts from something called the Digital Hypochondriac's Urgent Care Diary.
Yes, it's incredibly insightful, really captures these moments perfectly, gives you these raw, real-world stories.
Sounds intense. So what kind of stories are we talking about? Does it, like, jump right in?
It really does. Starts with, well, a total classic case, apparently.
Right.
Guy in his mid-30s walks in, sweaty, breathing fast, eyes wide, utterly convinced he's having a heart attack.
Yeah.
Right then and there.
Wow. Okay. So someone comes in that panicked.
Yeah.
What's the first step for the urgent care team? Especially when they've already, decided what's wrong.
Well, the diary shows they immediately go for the basics, the key details, asking about classic heart attack signs, chest pain, pain shooting down the arm, jaw
As
pain.
you'd expect.
Right. But the patient
Yeah.
denied all of it, said no to everything. His only symptom, get this, was that he felt his heart skip just once the night before.
One skipped beat. Seriously.
One skip beat. And then the diary says he whips out his phone, shows them a Google screenshot.
Oh, no.
Yeah. And he's saying, look, this says it could be a silent heart attack. I could be dying.
Wow. Just, wow. So what was it really?
It turned out to be anxiety
Mm-hmm.
and gas. Apparently he'd had spicy wings, a couple of Red Bulls.
Ah, the classic combo.
Exactly. And only got like 4 hours of sleep after watching conspiracy TikToks all night.
Okay. That paints a picture.
So the diagnosis was anxiety and indigestion, basically. But the key thing the diary points out is how the internet didn't just give him the wrong idea. It actually created the intense anxiety that made him come in.
That's huge. It wasn't just a misdiagnosis tool. It was an anxiety generator.
Precisely. And this wasn't, a one-off thing. The diary is full of examples.
Like what else?
Well, there's the patient who was absolutely sure they had colon cancer because their stool was bright red.
Oh, okay. That sounds alarming, admittedly.
It does, until you find out they'd just eaten a bag of hot Cheetos.
No, hot Cheetos.
Yep. One Google search took them from noticing something unusual to, as the diary puts it, having an existential crisis over junk food. It's kind of wild how fast that escalation happens online.
It really is. Any other examples jump out?
There was a woman who came in whispering, really scared, talking about a rare parasite from Morocco.
Okay. Had she been to Morocco?
Never. Not even left the country recently. She'd just eaten some hummus.
Hummus.
Yeah, and she had some vague symptoms, fatigue, bloating, a bit dizzy. She found a Reddit thread, something like symptoms nobody talks about, and connected her hummus eating to this, exotic parasite.
Good grief. And the reality.
IBS, irritable bowel syndrome.
Right. So what the diary seems to be showing is it's not that the staff think these people are silly.
Not at all. They get it. The diary makes it clear they understand why people get so scared.
Yeah.
Because online, everything sounds extreme. Like you search headache on one side, and the results jump from, like, tension headache straight to brain bleed. There's no middle ground presented often, no nuance. And that lack of nuance is terrifying for people.
So dealing with all this fear, this digital anxiety walking through the door, how does that change what urgent care actually does day to day? What's the diary say about their main job now?
It's pretty stark, actually. A huge chunk of their time isn't just figuring out what's physically wrong. It's what the professional calls de-escalating.
De-escalating, like calming people down.
Exactly. Turning that fear, that Google-induced panic, back into, well, facts. The diary gives examples of things they say constantly, like, no, that twitch in your eye doesn't mean you have MS, or that lump on your neck, it's not lymphoma, it's just a swollen gland from your sore throat.
Okay, common stuff.
Yeah, or even, no, hiccups don't mean your liver is failing. They actually describe the feeling of running a medical Google to English dictionary.
Wow. A medical Google to English dictionary, that really sums it up.
Yeah, just constantly translating scary search results into, actual medical reality, which makes you wonder, right? How much clinic time is spent on managing the anxiety versus the actual illness?
That's a really good point. But amidst all this like misinformed panic, did the diary mention any times where Google actually got it right? Was
Yeah.
there ever a counterexample?
Yes. And this is really important, I think, because it shows the other side. There was one case,
Yeah.
a pregnant woman. She started Googling shortness of breath in pregnancy, which, can be normal, but based on what she read, she convinced herself she had a pulmonary embolism, a blood clot in her lung.
Which is very serious.
Extremely serious. And she came in, advocated for herself based on her research. And she was right.
She actually had one.
She did. And the diary stresses that because she trusted her gut and her research enough to come in early and push for checks, it likely saved her life.
Whoa. Okay, so even though it's rare for the self-diagnosis to be spot on for something that serious, it can happen.
Exactly. It shows that the information can be empowering, can lead to life-saving action, even if most of the time it leads to, well, hot Cheeto panic.
Right. So you have the anxiety spiral on one hand and this life-saving self-advocacy on the other. After seeing all this, what's the main takeaway? What's the core message from the urgent care professional in the diary?
It really boils down to something pretty simple.
Yeah.
Google is a tool, not a doctor. That's the quote.
A tool, not a doctor. I like that.
Yeah. And the emphasis is on how you use the tool. The advice is basically use it to ask better questions, not to confirm your worst fears.
So research to inform your conversation with a doctor, not replace it.
Precisely. And the diary notes that, honestly, most of the time, the things people worry about have really simple explanations. Dehydration, anxiety itself, something they ate, maybe too much garlic.
Right. Or just needing more sleep.
Or just needing to, as the professional apparently says often, chill.
Just chill. Sometimes that's the best medicine. It really paints a picture of that urgent care setting, doesn't it? The diary describes it as.
Yeah, where every cough is COVID, every lump is cancer, every rash is autoimmune, until it's not.
Oof, that hits home. That's the initial fear talking, the Google fear.
Absolutely. And so their mission at the end of the day is kind of like bringing people back down to earth, patient by patient, cutting through the noise and the clickbait online.
Providing that reality check, that calm, accurate diagnosis that you just can't get from an algorithm.
Exactly. Context is everything.
Well, this has been really illuminating. It shows just how complicated our relationship with online health information has become and how crucial those real-world medical professionals are for giving us context and, frankly, calm.
Definitely. It's a balance.
So maybe the thought to leave everyone with is this. We live in this age of just information overload. How can you, personally, get better at sorting the good health insights from the noise, the clickbait? How do you use this tool to feel empowered, not panicked? And, maybe most importantly, when do you know it's really time to stop searching and just go see a doctor?